Thank you very much. Good afternoon. I'm Adrian Dixon, BC's Minister of Health. Beside me is Dr. Bonnie Henry, our Provincial Health Officer. Just in terms of our briefings over the next week, so you can prepare for those, will be the next briefing will be Monday, scheduled briefing will be Monday at 10 a.m. in Victoria in the Press Gallery Theatre. And after that, Tuesday to Friday, the briefings will be at 3 o'clock. On Tuesday in Victoria in the Press Gallery Theatre. And on Wednesday, Thursday, and Friday, they'll be here at the Vancouver Cabinet offices. And with that, I'd like to introduce our Provincial Health Officer, Dr. Bonnie Henry.
Thank you, and good morning, or good afternoon. So today we have a couple of things to talk about. First of all, we have 9 new cases that were identified in the last day here in British Columbia, so that brings us to a total of 73 confirmed cases. 7 of those people were in Vancouver Coastal, 1 in Fraser Health, and 1 which is still presumptive, but we expect it to be positive in Interior Health. So that will be the second case confirmed in Interior Health. The Interior Health case is related to travel to a number of places in Europe, most recently from Portugal. Also want to talk a little bit about the outbreaks that are ongoing. So most of the cases today that we're announcing are related to the outbreak, particularly the outbreak at the Lynn Valley Care Centre. We now have 4 residents who have tested positive and 12 staff who have been positive for COVID-19 from the Lynn Valley Care Centre. And Vancouver Coastal continues to monitor all of the staff and residents associated with that facility, and we know that there's some ongoing testing of others who are starting to show symptoms as well. This is not a surprise. When we first recognized the outbreak, it had just been starting, so we know that people are in that incubation period, and there may be more cases that arise in the coming days. The second outbreak that we're being monitored at Hollyburn House continues to have 1 staff person and 1 resident who are positive. Again, testing is ongoing. And previously I had indicated that there were 2 staff at Hollyburn that had tested positive, and there was a bit of a mix-up. That was actually a staff person who was associated with the Lynn Valley Care Centre. So currently at Hollyburn there's just a single staff person and 1 resident at this time. And the Lionsgate cluster of cases remains at 3 people who are in the admin section at Lionsgate. Additionally, 2 of the people that we announced earlier this week who were in Vancouver Coastal Health, they actually reside in Northern Health, and under strict protocols they drove themselves home, and so they're now in isolation at home in Northern Health. Just to be clear, so we have people in all of our health authorities that are at home in isolation with COVID-19. One of the most important things I want to talk about today is about our testing strategy, and we've been talking about this all along. With the new restrictions and advice that we're putting out around people returning from travel anywhere outside of Canada, it's not essential, and we don't need to test everybody who's been outside the country, even if they have mild illness. So we need to adapt, and we are adapting our testing strategy to respond to the situation that we do have here in BC now. For most people, you do not need a test. And we want to make sure that testing is available for all who do need it. And the focus will be on ensuring that we will continue to test people in active investigations and cluster outbreaks, because that's how we determine how this virus is spreading in our community. Healthcare workers, importantly, people who are in hospital and we need to understand what is causing their illness, or people who have more severe illness, and people in long-term care homes. That's the focus for the testing right now. And we want to ensure that everybody who gets sick gets the testing they need. For everybody else, even if you have mild symptoms or you have no symptoms and you've returned from travel, you don't need testing. And we want to make sure that people with no symptoms understand that they don't need to be tested for COVID-19. People with mild symptoms and returning travelers who are isolating at home do not need to be tested unless you get sick enough to require health care. So that's a really important message. We need to focus our testing so that we're able to ensure that those who need this test are able to get it. And finally, I want to ask everybody in British Columbia to be measured in their purchase of groceries and other basic necessities. We've seen in other parts of Canada and certainly some parts of BC, but people are you know, I think it's natural when you're in a situation like this where there's a lot of unknowns and there's a lot of concern about what's happening with this virus and the impact it's going to have on us and our families. And one of the ways that people do try and get some control over their environment is to make sure they're doing things like stocking up on things, and that can be provoked by anxiety. So I want people to be calm, to be reassured. We've been reassured by our retailers that our supply chains are strong and that they are restocking the shelves, and it really is a function of demand, and that we don't have an issue of not having enough supply. So I want to assure everybody that the supply is there, and we need to be measured in our approach and get what we need, but not to hoard and not to have anxiety-provoked purchasing. There's no need for that right now. We know that there's been a lot of events canceled. There's a lot of concerns about what's happening in our community, and I encourage everybody to take the time now to spend the time with their families, to go outdoors, to take advantage of the time and the space that we have, but to do it together in small groups, not to congregate in indoors in large groups, and to support each other across our communities. And we will get through this. It's going to be a challenging time for all of us. But now's the time for working together. It's a time for compassion. It's a time for supporting each other. Thank you.
Thank you. And as Dr. Henry has said, that's 9 new cases today. We continue, of course, to be extremely concerned about the situation at the Lynn Valley Care Home. That goes without saying. And it is a good reminder to reinforce what we continue to say about all care homes in BC, that people, we have to be very careful not to visit care homes or anywhere, but care homes if we're sick, not to visit parents or grandparents who are our elders if you're sick, not to visit them, and to provide support in trying to address the possible social isolation people may feel as a result of that through other means, through regular contacts over the phone or on FaceTime, or however people choose to do that. It's obviously critically important in that effort. I want to reinforce what Dr. Henry has said about testing. I think, as noted yesterday, the people at the BC CDC and in the health authorities have done an extraordinary job with testing. There is a clear direction in testing policy for us to be effective in containing and slowing down COVID-19 in BC. As Dr. Henry has said, we have to prioritize, and that includes prioritizing on current investigations, prioritizing on healthcare workers, prioritizing on people in hospital and around hospital. And so what we're asking people to do with mild illness is to isolate at home, and the direction to all people returning to Canada to isolate at home for 14 days is an important one in what they need to do. Obviously, if people are seriously ill, they need to contact and get assistance for that. But we need to help everybody in our society to ensure that the extraordinary efforts towards testing are prioritized to help everybody and to reduce the scope of the outbreak. I want to say with respect to testing centers that there will be so-called testing centers set up with these criteria in mind in health authorities, and health authorities in the coming day and days will be announcing locations for those, and we'll be managing that. But I think it's very important, as we've seen in some health authorities now, and we are sometimes seeing at urgent and primary care centers as well, that people not present there, and we not have, that we ensure that the people who need to be tested most, who are prioritized for testing, get access to testing. But those announcements about when such testing centers will happen will be the responsibility of health authorities, and you will hear from them in different communities. As noted by Dr. Henry, we now have COVID-19 cases, people living at home in isolation, recovering from COVID-19 in all 5 regional health authorities in BC. In Northern Health, the 2 cases that had been previously identified in Vancouver and in Interior Health. And finally, we want to say and give the advice of the Retail Council, there are no shortages of goods. What happens on shelves is a result of intense buying, and we are asking people to show moderation here to one another and generosity to one another and to the people working in the stores and working in the industry, so that we work together better as a community, as a society. There are not shortages. The supply chains are strong, and we have to try as best as possible to revert to normal practice with respect to buying supplies in grocery stores and other places. This is a clear message from the industry and from the government of British Columbia.